Hi guys, welcome back to Vibes with Dr. Ruth Grace, and we are going to be sharing about fibroids and especially fibroids in pregnancy. Now, I know that many moms have asked me that question, and I know this question came up from my mother who was asking about having a fibroid and also being pregnant and having to undergo a cesarean section. And she was asking, will I really try a vaginal birth after cesarean section, yet I have fibroids? Now, we're going to be sharing with you about what fibroids are and then also sharing more in what happens with fibroids in pregnancy. If you have not watched our previous episodes, please check our pages at Future Hand Uganda on our YouTube. Check Vibes with Dr. Ruth Grace and also on TikTok at Dr. Ruth Grace. As we kick off into this topic, I wanted to mention that one, being female is beautiful. And being female comes with also having a hormone called estrogen. The estrogen is the hormone that makes us look beautiful and also fancy because, well, we are female and that is it. We cannot go away from what we call the hormone estrogen. Why am I over talking about this hormone? This hormone is the hormone that also influences a lot that happens in your body, how you have your period, and also you having a uterus also influences what happens inside there during your menstrual cycle. How is this related to fibroids? Someone is going to ask me that. Now, fibroids are non-cancerous lesions. By lesion, we mean like things that you find that are not supposed to be there, but they're somewhere inside your uterus. These fibroids can occur anywhere inside the uterus, outside the uterus, just growing on top of the uterus, or somewhere inside the muscles of the uterus. Now, some people ask, how do I know I have a fibroid? I will tell you. Most times you will not know you have a fibroid. Fibroids are usually common within the ages of like 30 to 50 years, and all the same ages of reproductive age, right? So as long as you're exposed to estrogen, that is, as long as you're female, you're more likely to have a fibroid. It is said that every 2 in 3 women will most likely have a fibroid once in their lifetime. Some of them will never know they have them because they've never gone for a scan. The reason we are having an increase in the numbers of fibroids that we are now seeing is not because our parents did not have them or our great-grandparents did not have them. It's now because we have easy access to ultrasound scans. When you go for a routine test and then out of the blue, you're just going for a body check and you're female, you end up into a scan somewhere and then someone tells you, oh, we are seeing a fibroid here. Oh, we are seeing this here. That is how you know you have a fibroid. Sometimes the different ways, let's say you have a fibroid and you're not feeling any symptom. Well, that can also happen. Do we do anything about it? The answer is no. If a fibroid not causing you any problem, please would not do anything about it. I know many of you mothers out there, you go and do scans and then out of blue you come out and say, fibroid. I'm scared. What am I going to do? The truth is that we don't do anything about it as long as you have no symptoms. Now, what are the symptoms that we are talking about? The very obvious symptom that most women experience is a change in their period. And how is this change? They're going to realize that now their period is either becoming heavy or painful. So at first, you never used to have painful periods, but something is happening. You're just getting more painful periods. And then the other thing is that now they become heavier. If you are using about 2 to 3 pads a day, this time you start realizing that, wait a minute, now I'm using even a packet a day. Or I'm using a packet in 2 days. Then you start suspecting something is wrong. Some women even get worse symptoms where they end up even bleeding on buckets. Nga pad tezichakola, wabugoyete buchakola. Yava mu pad nagenda mu butawel, then nananto koisa chi, natanko koisa bucket. So from pads you went to a towel, started using a bucket to collect the what? Clothes. You start realizing the blood is changing, it's becoming darker, it's becoming clotty, and you don't understand what is happening with that. That is the commonest symptom that women experience with fibroids. For some others, they may experience different symptoms depending on the size of the fibroid. Usually fibroids that are larger than 6 centimeters will cause some compression symptoms. We call them compression because where the uterus is, the uterus neighbors are two interesting areas. One is your bladder, where your urine is kept. So if it is neighboring a lot, if your fibroid grows very big and is neighboring your bladder, it starts pressing onto your bladder and then you find that you're urinating more frequently. It's not because you have a UTI, but it's because your bladder has a less area to fill up with what you have drunk. So because the fibroid is pushing onto it, you end up getting a small volume that you can usually keep. So you start realizing, for some reason, I don't even drink a lot, but I'm peeing a lot. Then, if your fibroid is bigger, but then it's compressing the other side, the back end, that is where your rectum or like the gut that brings out our food waste, okay, that we throw in the toilet when we go to do number 2. If it's compressing there, you start realizing that I am getting a lot of constipation these days. And sometimes you realize this constipation is happening, but then there's just very little that is coming out. That's what also a fibroid can do. The other compression symptom that is very funny for some people, or some people may not some people may even feel shy to talk about it, is something to do with having painful intercourse. So you're having painful or discomfort intercourse, like for some reason, where you are having sex and enjoying it, it's becoming harder to enjoy, and it's like there's something just pressing, because some fibroids actually push down onto your uterus and bring your cervix closer, or they lower your vaginal tract. So they make your vaginal tract shorter. If you're shorter, an average vaginal tract, I hope you know how long it is. It's almost as long as about 7 to 9 centimeters. So if it's pushing down, it shortens that vaginal tract. So you end up having painful intercourse. Those are some of the symptoms of fibroids. The other one, some people just get a big tummy. The tummy starts swelling and swelling. You're like, or you're getting fat, or you're getting bigger. Is it true that you're getting bigger, or you actually have a fibroid? In medicine, we usually say if you're getting bigger, we have the 5 F's that we usually say. Either you're fat, that is because you have extra body fat, that is you're big obese, or you are having extra fluid in your body, or you have a fetus, that is your baby, or you actually have something else. In gynecology, I'll add an F. The F for fibroid. So if you see your tummy is getting bigger, even if you're a small person and you don't expect something to be happening, you don't even expect to be pregnant, you've done pregnancy tests and they're negative, most likely you may be having a fibroid. So you go and check that out. So when we have those, and for example, someone comes to you, you've done your scan, like I've already said, a scan is the one that is used for diagnosing fibroids. After you have done the scan, what next? That is always the biggest question. If your fibroids are not affecting your fertility, now fertility is the other symptom, but most times you will not know that the fibroids are affecting your fertility unless you're trying to get a baby. Now, if you're a young lady out there and you're trying to get pregnant and you're not getting pregnant, you have fibroids. Most times we say, Neda, these fibroids may be the problem. And why is that? Someone may say, I've gotten pregnant before when I had fibroids. That is okay, it can happen. But there are some women out there who either experience recurrent pregnancy losses or those who cannot get pregnant. Because sometimes where a fibroid grows, a fibroid can grow close to the tube so that it ends up blocking the sperm from reaching the egg and in the tube where fertilization occurs. The other times fibroids can be very big, and then they prevent the attachment of a growing baby inside the uterus. So the baby is trying to get where to implant. The process we call implantation tries to get there, but they cannot get implanted because the fibroid is where they're trying to get. And the other bit that also, if depending on how big the fibroid is, especially fibroids that are very big, even up to 10 centimeters, those, when you are pregnant, those can also cause preterm labor. Now, what is preterm labor? Preterm labor is where you get into labor or you get contractions before your baby reaches the time of coming out when they are mature. Now, why does this happen? Because the fibroid is too big, so it starts stretching the uterus. Now, you have a baby also stretching the uterus. You also have a fibroid stretching the uterus. So you end up having babies that come out when they are very, very young, or what we call the preterm babies. All that can happen. And then the other bit, of course, if you're having discomfort during sexual intercourse, you start losing the appetite for sexual intercourse. And yet we recommend that you're supposed to be having frequent intercourse at least 3 times a week if you're trying to get a child. And that is how you can get infertility symptoms or fertility symptoms when you have the fibroids. So what do we do? Now, if you're a young woman looking for a baby, normally we get those fibroids out. We get them out because we want to ensure that your baby, one, you can have a high chance of at least the sperm reaching the egg for fertilization and also having enjoyable sex. And then 3 is that at least you can have a chance for your baby who is forming to be able to implant well in your uterus. The other thing that we recommend, if your fibroids are less than 6 centimeters on a scan, we don't really do anything for them. But if your fibroid is causing you see the other symptoms we talked about, the heavy bleeding, you're feeling like your stomach is the other side, it's bloated, it's distended, please, those ones we get the fibroids out because there is no reason for you to keep a fibroid. My famous teacher, Dr. Kayondo Musa, a pelvic floor surgeon, he always says that a woman's uterus only has 3 roles. And I think that was also from Dr. Mayanja, the late Dr. Mayanja. He says the uterus has 3 roles. 1 is to menstruate, 2 is to give birth, 3 is to bring for you tumors and cancers. So if it's bringing you the tumors and cancers, you take them out, especially if they are causing you symptoms. Now, back to the lady who was asking me about a fibroid and pregnancy. Fibroids and pregnancy, the things that we usually worry about, apart from just trying to get pregnant, when the pregnancy gets in, most times people have miscarriages. Again, if the baby is unable to implant into the womb, the baby will have to come out. So people end up with those miscarriages. The other is if you grow, your baby grows, your baby has little space of playing around inside the tummy. So what happens? You find that most of these babies have malpositions. A malposition in medicine is normally a baby is supposed to be upside down. The head should be down and then the other part, the butt, is up. But most times you'll find that when a woman has fibroids, that baby does not undergo that complete turn, because as they're trying to play and turn, what happens is that the fibroid is blocking them from also moving and playing around inside the mommy's womb. So they end up having to be in a position that does not allow for a vaginal birth to occur. And indeed, many of the mothers that have fibroids end up either in an emergency cesarean section, or they can also end up in labor, but then you realize this labor is taking too long. You could be a mother who has given birth before, but for some reason this time round, things are taking long in labor. Yeah, that can happen. So you realize, oh my God, your baby was actually not lying in the uterus very well, and then you end up having an emergency cesarean section. That happens a lot. The other bit is that at the time of close to delivery, we have to confirm. Sometimes your baby may be upside down, but then you find that your baby is actually facing the wrong direction. Now, I know babies are very interesting. In labor, babies determine if they will come out or not. Now, if your baby has been in a position where they are not flexed. Now, what is flexing? Flexing is where you have to be like this. Or when I know kusala, okay, your baby must be bowing down like this. Now, if there is a fibroid, let's say this microphone is a fibroid, and your baby tries to do like this, but then they stop, it means your baby is not going to present themselves in a right way. So you're going to have a malpresentation in labor. And that baby will try as much to come out, but they will not come out. And when you have the other impact of having fibroids when you're pregnant is that sometimes when you get the fibroids out, especially the fibroids that are inside the uterus, those ones, when we get them out, will leave a scar on your uterus. So whereas you've never given birth to a child before, or you've given birth to your children before, even if they were vaginally, this time you have a scar on your uterus. So you are actually like a cesarean section mom. And you have to follow the same regulations that we usually give. Take at least 6 months of healing, and then you also get to a point at least of 18 months where you can now get a pregnancy and try for a vaginal birth after. Now, because the surgery is related to myomectomies or to fibroid removals and not clean like cesarean section surgeries, most times your gynecologist is going to recommend that you have a cesarean section, an elective cesarean section. Why? Because if you have had multiple fibroids and your uterus has been cut multiple times, it is most likely that when you get into labor, your uterus may actually rupture. By rupture, I mean burst, an actual burst. So you have to be careful. I know some moms who have never given birth before, they get very scared when they are told, we've removed the fibroids, yes, but then we have to also deliver your baby by cesarean section. They freak out. Do not freak out. This is to save your life, and you have to know that. So always follow what your gynecologist tells you. Don't wait for labor and try for labor at home. If your gynecologist tells you that, yes, the fibroid surgery we did can allow you to give birth, then yes, you can go ahead and give birth. But do not wait. If at any point you get any labor pain, it means you have to be in hospital immediately. Like within the next 30 minutes, you should be in a hospital, and you will be monitored very frequently. So you will not be going through normal labor like the other moms where you have a lot of time of resting and that. So you have to be checked on very quickly, because anything can happen. A uterine rupture, before it happens, your baby starts getting tired. Your baby starts showing us signs that they're not happy inside the uterus. Something is wrong. And most times when we go to theater, we actually find that your uterus is starting to separate. So before it ruptured, we're starting to do that. And what happens during a rupture? A baby dies. After a baby dies, the next thing is your uterus is also bleeding profusely. You may also end up losing your life. That's what we usually recommend. Now, any woman that has fibroids and gets pregnant and you give birth normally, that's okay. Does that mean that every time I have a fibroid, I should have an operation? The answer is no. Again, it depends on the size and if it's causing you symptoms. If it's not causing you symptoms, please go ahead, plan for your pregnancies. Please go ahead, have your very good sex. Please go ahead and enjoy. Because the fibroid will not go away because you are female. You're just okay with having it. If they're not causing any problems, you can have your children, you push them very well, and then wait for menopause. In menopause, they will shrink and then they will be there. Nothing you can do about that. In case you have not, you're having those symptoms, please don't try the local herbs. I know most of us try the local herbs. We try a lot to say, okay, I try this, I try that to shrink the fibroids. Just do the medical way. Do the medical way, because when you take longer, your care medically and also surgically takes longer and impacts your lifestyle. Women who bleed a lot during their periods because of fibroids end up with severe anemia that later leads to actually heart failure. So mchala jamudwaliro nga omutima tegukuba bulungi, or you come to the hospital and you're almost close to a heart failure. We need to first help you to survive. So always feel free to always ask your gynecologist where you have concerns, where you have questions to do with, okay, what is happening with me? I have this fibroid. Okay, I have that. And then some people are very keen at monitoring how big their fibroids are getting. What we usually recommend, when you see a fibroid on your scan, discuss with your gynecologist. After discussing with your gynecologist, then go ahead and have a follow-up of at 6 months, between 6 to 12 months. You can have that follow-up just to check, is the size of the fibroid increasing? And if it's increasing and it's above 6 centimeters, sometimes you may want to remove it. But other than that, if there is nothing, then you do. So the take-home point for today, as we're wrapping up for this session of Vibes with Dr. Ruth Grace, is that we can have fibroids as women. Every two in 3 women will have a fibroid, especially women of the African origin. So if you're African, you're more likely to have fibroids. Are fibroids a curse? The answer is no. Is female being a curse? The answer is no. But what is good to know is that, yes, I am female, and yes, I can have fibroids, but I need to help them. I need to know, have information that can help me so that I can be able to have a better life and also seek for care very quickly before this becomes a problem for me. And then lastly is that when women have fibroids in pregnancy, it is not a must that you're going to have any challenges occurring, but please always have antenatal care as routine as possible and with a gynecologist. Do not deliver from home, deliver from the hospital, and always follow through your antenatals. Fibroids in pregnancy will hurt sometimes. Yes, they are complicated pregnancies, and that is why you have to be in hospital. Thank you for watching, and don't forget to follow at Dr. Ruth Grace on TikTok and also at Richard Hand Uganda on YouTube. Bye to Dr. Ruth Grace. Thank you.